But now we're here. And it is a great day. Okay. We have two beautiful faces next to us. In between us, Kim and I, we have
Dr. Janze.
Hi.
Yes. And y'all know the familiar
Auntie
face
V.
down in the corner, Auntie V.
That's Auntie V. Mm-hmm.
And we are going to be discussing IV hydration and all some good stuff with that. And we're going to see how that works alongside of CBD. So with the IV hydration, how do you know as a novice what bag you should take?
So that's why you come to me.
Mm-hmm.
And so I talk to my patients. That's what they call me. So I talk to, and I get medical history. So when they come, I always ask like, what's going on with you? Like, how are you feeling? So that I'll know, well, I can kind of pick and choose, well, this may be good. So for people that's really tired, brain fog, fatigue, just depleted, don't really eat much, always on the go, my revitalized drip is always good. Okay. And I always say, hey, let's up how much fluid I give you too, because that really is going to help with your dehydration, your brain fog, your fatigue. And it just really makes you feel good overall. And it helps to reduce your stress level, and it also helps you sleep well.
I know that's right.
Okay.
Yep.
Okay.
And some people actually have experienced, and it's probably TMI, but their digestive system is moving a lot better. And so it really has all those components to just relax you, calm you. You're not feeling as tired or fatigued. And then if you come, like for people who want skin health issues, then I have a drip for that. And so really it's about, for me, communication, understanding what's going on with you. So at least I know, let's try this, or and this is how often we need to do it.
Okay.
So I talk with my patients, and that's part of why I started. Even though, it's a service that I offer that you may see like franchise places, they don't customize typically, and they don't build that relationship to understand. And while you're getting your drip, it's like a therapy, because I sit right there and we talk.
Okay.
And so I have a lot of people that come and just talk. I guess I'm just one that, people are comfortable and they talk, which is my space is that safe space for you to come and talk about what's going on. And I had a client, patient in particular, that came particularly for weight loss. So we're just talking about all the things going on in their life. And, I said, what is that thing that you do to take care of yourself? So I'm really big on self-care. And I know that from a personal standpoint, like I say, I'm married. I've been married. We'll be married 20 years next year.
Oh, yeah.
And we have 3 boys together, but it's not always great, right? It's not always the peaches and cream. And so I have learned throughout all this time, I love my husband, I love my kids, but I also love me. And that was a time where I was like gaining weight and I was at a size I did, so I really had to take a step back and take a focus on me, love me. And, I used to travel with my old career, and I used to make sure like everybody had food, all clothes were done. And I said, you know what? If they eat hot dogs and cereal all day, it's all right.
Of course it is.
Yeah. Why am I running myself on the ground for that?
Of course it
You
is.
know what?
There's nothing better than having cereal.
How Southern Auntie V can be about serious shit. Like we're talking about. Of course it is.
Well, of course it is.
Of course. Eat those fucking hot dogs.
I used to be like, stop eating my kids hot dogs.
I think that is hilarious.
Why not? That's a staple in my
Here's
house,
your
hot
ketchup.
dog.
Here's your mustard.
Yeah.
I even got some relish for you,
Why
baby.
not?
And a bag of chips
not?
and sit your ass down.
Because they're old enough to reach it. They're old enough. Yeah. They know how to split a hot dog down the middle and stick it in the microwave for a minute. They know how to do that. As long as the microwave is on their level. What are y'all talking about? I know.
I got done working to eat that damn hot dog.
Yeah.
They be like, what we eat? I don't know.
Gen Xer, but still. I mean,
I
come on.
make sure I have lunch. That's what I focus on. But that's the big piece of like how IV had. So it really helps to relax you, reduces your stress because it has some magnesium in there, which is great for like relaxation. And so that's why people feel so good after they get their drip. So
Yeah.
And what do you say to people who are like, well, I take vitamins, I don't need an IV drip?
Yeah, so great. Keep taking your vitamins because one thing, if you notice one, they're huge pills. By the time you swallow and it goes through your digestive system, you're really not getting that big old pill. You're probably getting about that much of it, or less. And if you have digestive or GI issues, you're really not absorbing much. So the IV basically, it bypasses your gut. It goes straight to your cells and it fuels you in a way that those oral supplements don't. Not to say you shouldn't take them, you know, but still you can, because it's not like you're going to overdose. But that's the benefit of it. Plus you're getting hydrated. Your cells are happy and they're like plumped up, feeling good, like moving around like they should, versus you're trying to drink a bottle of water and you're not drinking enough, because even though people say I drink all day, you're probably not, because once you start pooping and peeing, sweating, you know, things like it goes through your body's process. So you're still not absorbing enough. So.
Yeah. And when you have a nice, fat, plump little happy cells, CBD works. It's a synergetic work. They can work together. And, you know, for your immune system, for hydration, because it just works better. The calming effect, the decrease in your stress levels, your inflammation, you know, pain, anxiety, inflammation, it just enhances it. So if you've got nice, happy, plump little cells that, you know, and your vasculature, I don't know, your blood vessels, you know, are running smoothly and they're fat and they're happy and oxygenation is going through and things are exchanging. CBD just catches on to them, honey, and it rides the wave with them. And it enhances, it decreases your stress. It decreases the inflammation, your pain. It just works so well when you look at your healthcare in a holistic manner. And we talk about that all the time. You have to make things work together because your body is not singular in each system that you have. All of your systems work together to make you work.
And let's talk a little bit about inflammation, because this is something big, especially in the dental community as well. If you get rid of the inflammation, it helps a lot in your body, because inflammation is rooted to a lot of issues and people don't know that, you know, and they just think, oh, I'm just swollen, or I'm just this, or this is just a problem. Or like, no, your body is telling you something is wrong here. We have to get to the root of this, because there have been links from the inflammation in your gums, from periodontal disease to Alzheimer's and diabetes and heart disease and things like that.
Big one's heart disease.
Yes. So that's why it's just like, let's talk about how important it is to get that inflammation out of your body.
Oh God, yes. Well, I mean, but you know that it again, they all work together. Your systems, whether it's the nervous system, or you know, the biggest organ, you know, is your skin. But they're all systems and they don't work, you know, independently of each other. You are a whole person, and you need hydration. You need to be rehydrated, you know, so that everything that all of my products just are enhanced with IV therapy, with eating correctly, with exercise. We talk about that all the time. And decreasing your inflammation is a big one. You know, think about your joint pain. Think about, I mean, that's a big one. And even if you think you're healthy and, you know, pre-workout and post-workout and muscle pain and, you know, and the lactic acid that, you know, that your muscles release, you know, during that time, it all works together.
So
it all works together.
Saying that, that was going to be my question, because dealing with younger athletes, how important is that for their recovery, especially something where you're introducing a CBD where, you know, people always have misinformation. And then IV therapy, they may think that they're too young, like for a high school student. So can you guys talk about that, especially with hydration? Because a lot of young athletes are super dehydrated. You have to beg them to drink water. And then a lot of them don't take care of themselves post with making sure that they're, you know, bumps, bruises, muscles, and all, they don't even address it. It's just keep going. So can y'all talk about the importance of that, you know, on an athletic aspect of the goal is to recover as quickly as possible, and how these products can help you with recovery.
Yeah. So it's funny because I have a 15-year-old that plays JV football.
Mhm.
And so a lot of the kids at the football game, you'll see after a play, the first aid person or the trainer actually is running out on the field and they're like pushing their leg back inside, all these things because they're so dehydrated. They're cramping up and all that stuff. And so it's important that they stay hydrated and get hydrated. The beauty of what I offer is I'm not giving any like drugs. It's all vitamins and supplements. And so I will tell my son, I'm like, hey, I'm going to give you a drip. And so, sometimes he'll be like, okay. And I told him, I said, well, we need to do it like so many days before your game so that it's really in your cells, you're feeling good, but it helps them to overall feel good. It goes straight into their cells because they're practicing every day for several hours a day. They're not drinking enough, even when they're out on the field. And then by the time they get home, generally it's after 8:00. So they may have homework. They may need to eat dinner. They drink a bottle of water. They got a shower and they go to bed and it's probably midnight. So they're in school all day. They're probably not drinking enough water. And so I try to make sure that mine take bottles of water or fill up but they're still not drinking enough. And it's so hard to hydrate them because they're in practice 3 days a week and a game 1 day a week. And then on the weekend, they're probably, doing nothing. And so they're not taking in enough fluids. And so it's so hard to hydrate them. And the benefit of the IV is, again, to go straight to the cells. And it's literally, they don't even have to have vitamins. They can just get the fluid. And that would be really beneficial for them. My son actually today, and my basketball player, he texted me the other day and was like, Mom, can I get a drip? And I've given it to them before, but that just goes to show it works so well and he feels so much better with it. And so I was able to give him his today in between his classes before his workout. And I asked him, I said, well, how do you feel? And he said he can tell a difference. And so when he started asking for me, obviously it's something good. And I give him vitamins in his too. And it's literally just amino acids, vitamin C, vitamin B, and a mineral blend.
Okay. And then muscular, let's talk about like topicals. So like for the bruises that are sitting up top that aren't too deep.
Well, see, the goal is not to get to the bruises, not to get to that phase because, we all know bruises are broken blood vessels and your body. Now your body's in recovery. It's trying to heal itself. So the goal with topicals is not to get to that phase. So when you're working out, when you're obviously dehydrated. These young people are doing, this back to back, having practices back to back to back, and in games. So you don't have a lot of recovery time anyway.
No.
So the thing with topicals is that, as we said, number one, it's going to stay where it is, but it's going to help relax that muscle so that your pre and post is the recovery time is shortened because most athletes, no matter how old you are, you need to have some refractory, some recovery time, hence ice baths and everything that we try to do that it is. What CBD does topically is helps your muscles relax and calm them down and decrease the inflammation in those within that area that you put it. We have John's testimonial, who's a professional athlete. He's a professional football player. He talks about that because that's what it helps do.
Right.
He had, he's playing at the top of his game and he uses topicals to help do just that.
Right.
Because these people are getting aches and pains and it's real.
And so like one thing that I want to just clarify, because my platform is athletes with the First and Goal podcast, but I want to share this information. So those who may use Tiger Balm, which I'm not a fan of Tiger Balm, or I'm not a fan
numbing.
of like
Icy
hot.
Yeah,
Can you speak to how
the area?
Can you speak to how your product, as far as the roll on and the salve, are completely different
it is,
versus the Tiger Balm and the Icy Hot?
Yeah, we're not trying to numb it. We're trying to deal with the cause of it. We're trying to get to the muscle itself and help the muscles recover. I'm not trying to numb the area so that you can continue on and play, whether you're hurt or not, because it does exactly that. You're numbing the area.
Right.
Yeah, you can go out there and play because you don't feel anything.
Right.
Cause more damage.
You can cause more damage. That's not what we're doing. What CBD minds, I can't speak for everybody.
Right.
Because I don't know what's in everybody.
And we don't want nobody to buy anybody else but yours.
Yeah. We're trying to help the muscle, the cause of your issue, which is that, you are stress and straining and pulling and, muscle fibers, no matter how old you are, muscle fibers. And then you're trying to ask them to recover it in a very short amount of time.
Right.
This helps take care of that.
And then so
that muscle pain, that stiffness, that soreness, that inflammation, because that's just your body's natural way of healing itself.
Right. And like Dr. Janze said, with the hydration, start a few days before.
Absolutely.
And for these young folks, this is a pre-practice ritual. It should be, as far as these items.
Absolutely. For the topicals, absolutely. Because that's what you're trying to do. You're trying to lessen your time in recovery. You're trying to not be as sore, to not be as stiff, to not have as much inflammation, to have that that overall body aches, because you're playing a physical game, especially football. You're playing a physical game, and that's what's going to happen. That's just that's the nature of the things. If someone's hitting you like a freaking freight train
over and over again,
every time, all the time, because that's what they're doing.
Right.
You have a person in motion and you're stopping it. You've got some 300 pound gentleman literally stopping. So everything's gonna hurt.
Right.
That's just the process of the game. Everything is gonna hurt. So it's just trying to lessen that.
So 2-part question. One of the things that I want to ask is, when it comes to like students, I know that it's tough because you have to deal with their parents and stuff like that. How is there a way to possibly get them to, to get them to do this more often, to do the IV hydration, to do the CBD? Because some of them probably willingly due to lack of knowledge, and thinking, because I'm young, I don't need to do this stuff. But these are all preventative measures, because you can, like you said, ultimately really severely damage, your muscles, your ligaments, whatever have you, if you're not properly hydrated, and then if there's no proper aftercare. So who are the people that can advocate for these services in these spaces?
The trainers should be number one, but there's no bigger advocate in amateur athletics than a parent, because even the trainers, they're not with the children as much as a parent is. Whereas in the NFL, you wake up, you go see your trainer because that's a part of your contract. You have to go see your trainer. You have to do these evaluations daily. So to me, getting these items and using these items, parents need to, one, try themselves. I think so. Try it yourself, and then also allow your athletes to try them so that they can see the difference. Now, me as a coach, you're going to get coaches who are hesitant, because a lot of coaches are old school and they're not up on this. You know what I'm saying? So, and then when you start talking about IVs and things like that, they're just, for lack of a better word, they're just ignorant to that. Their hydration is drink water and Gatorade. And I used to love killing my kids with, water's more important than Gatorade. No, coach. Okay, look at the first ingredient of Gatorade. And they would turn, what does it say? Water. Thank you. Gatorade without water, goofy. But I do think that the parents need to inform themselves about how quickly they first of all, they need to know that their children are in pain. A lot of these young people don't express it because they just think it's a part of the game. And then you'll see injuries that last longer than what they should. I've experienced that, where you just got a kid that's on shoulder sore, and it's like, oh, you have a torn rotator cuff, and you've had it all. So get your athlete to talk and then actually going to these places, trying them yourself. So I'm promoting this specifically on First and Goals podcast. That's why I'm asking you guys so that more parents can be aware.
Because it's about prevention.
Mm-hmm.
It's about and even if, because things will eventually happen as long as they're playing the game, as long as it is a violent game, then things are going to happen. But try to, because the goal is for you to make your muscles more pliable.
That's the key.
That's the key. That's the key. Because I mean, let's be honest, we are, we do diet, we do these regimens with these young people, we do all this stuff, and we make them into these very lean, very efficient machines, depending on their position. Because I mean, even your front lines, I mean, my God,
they're not built the same the way it used to be.
Boom, who cannot move.
No, these guys are rolling.
All these gentlemen are agile. They're lean. They've done all this work. Yeah, but you've got to be able to shorten that recovery time, because you're asking them to do a lot.
And you're asking me to do it again the next day.
And you're asking them to, because that's not normal.
Yeah.
None of these professional athletes, that's not the normal wear and tear on a body.
Yeah. And the one thing, Dr. Janze, if you can explain, even if you're just intaking water, how much should the average athlete, and we ain't talking about the athlete that's going hard, just the average athlete, how much should you intake a day?
So the generalization is pretty much like half of your body weight and more. Who can do that?
Yeah, that's crazy.
That's a lot. I mean,
now, is that your ideal body weight?
Oh, right.
Because calculated ideal body weight for me is quite different than actual.
Unless you walk around with a couple of gallons of water, you're still not getting. And then people say, "Oh, I drink water all day." You're still not hydrated properly.
Just because you got a Stanley Cup don't mean you hydrated.
And you haven't times you fill it up.
Right.
Because I know I'm terrible. I fill up my cup one time.
No, wait a minute.
Well, I can't say
I'm in
that.
my rooms all day, so it's so hard, and I know I'm dehydrated. And I know when I know, like I know I need a drip now. And
so then, with frequency, is there such a thing as too much when it comes to the drip? Because we know with your product, Ms. V, like you use it as needed, and then it should be a part of your normal routine.
It should be part of
Yeah, good question.
So we're talking
if I'm
balance.
Too dehydrated, is there something I need to be looking at health concern wise? Like if I'm constantly dehydrated, is there something else going on that I might need to check out?
Yeah. So if you're dehydrated, one, you want to look at your kidney function because that could be terribly impacted, and you just never really know. Muscle cramps. Some people can experience, like Ms. Auntie was saying earlier about the lactic acid, and how when you're working out, it gets into your blood. Some people can develop what they call like rhabdo, which is like your muscle breakdown and it filters out through your kidney, which your kidneys are. So it's just like every system in your body works together. And so the big damage is organ damage that it can cause. And so you don't want to get to the point. And the beauty of IV hydration, again, it goes straight to your cells. How often you can get it, I tell people it really depends on your health goals. And so depending on what you have going on, that's why it's important to have that conversation, to talk to your patients or your clients about what they're feeling, what's going on with them. And generally, I'll tell people you can start out, let's do like once a week or so many weeks, and then we'll do a maintenance once a month. Some people every other week, and then let's do maintenance like once a month. But truly, it just depends on, one, their health goals, of course, their budget, because I don't take insurance, and then just generally what's going on with them.
And then for muscles, like you said, if I see the bruise now, it's too late.
Well, yeah, because I mean, you have a bruise, so that's your body, depending on what color it is. That's your phases of recovery. That's your body's phases of recovery.
So then now, let's say a student after practice, he is complaining about like his shoulders or his hamstrings or something like that. which one would prefer him to, or which one would suggest a parent, more the salve or more the roll-on for like a hamstring pain or just shoulder tightness, or which one would you suggest more?
Well, that's going to be topical because it's just a faster onset and it's quicker, but it needs to be massaged in. And let's be honest, if you're cramping and doing all that kind of stuff, you probably should have been hydrated first. I mean, because that's directly what's called problem, I would think, because if they're young and healthy, they have no reason for it to be anything else.
Right.
Other than, especially like I said, cramping, because we're talking about electrolyte shifts and that. And we're talking about a whole bunch of other things that that IV therapy can take care of. So on my end, it would be topical.
Okay.
Because we're already there.
All right. And now you have the lotion, you have the oil, salve, and roll on. So which one would you suggest for an athlete who is feeling the tightness? So like,
well, the roll on, I always call this a sport roll on because you can throw it in your bag, your gym bag, you can throw it anywhere and you can just rub it on. And I think that it works within a couple of minutes. I mean, so that would be the quickest. The salve is, of course, a little thicker, but they work the same. That's a preference.
Okay,
that's a preference.
Okay.
With athletes, like I said, this is probably more convenient for them, because it's not as thick as this. But this would be the easiest thing for them.
Gotcha.
Because they can just take it, roll it on, work it out. And they'll
go.
be and go.
Yeah. And for those who are watching, or for people who need to see testimonials, hear testimonials, please go to thehealingconsultant.com to find out how quickly it works.
Yes.
Because the one thing that everybody says, we were at the Mind, Body, and Spirit conference, and we told a young lady to try it and walk and come back and see us, but she didn't even make it halfway around the corner before she turned around and was like, I feel it already.
Absolutely.
And with athletes, recovery is key because you have to turn around and do this again and again and again and again. Then you play a game. So you want to make sure your muscles are recovering as quickly as you can possibly get them to recover. So please check out the items that you see that are topical on her website. So that's the salve, that's the roll on, that's the massage oils, and then the lotion.
And you like the drops.
Ooh, the drops and the gummies. When I
decrease the stress, honey.
So many
saving lives.
You are saving lives. You're saving lives and people from getting cussed out.
Yes,
they need to thank you.
Saving lives.
Yes, they need
to
thank
you.
Your girl, Messy letter needs some CBD.
I think she does.
Like I
poor
said,
baby.
Well, I told you she depleted. Yeah, she got to come up here in order to make those decisions.
She need to go back and forth between the two of y'all so she can get it together.
Because I know she's dehydrated. Dehydration is no joke, y'all.
Really
I promise y'all. As an athlete, I have been dehydrated before. You hear coaches yelling at you, need a sip, but I was always taught that if you get to the point where you feel like you need a sip, it's too late.
It's too late. Behind the curve.
And it affects your mood. Like I remember I was just being a legit bitch. And then when I got some water, I was like, oh, I'm sorry. I was dehydrated, girl. I'm sorry.
It's real. And even me, I'm busy. Work full time. I operate my business, and I was just going. I mean, just like nonstop. It was something. And I was at work one day, and I was like, I gotta go. It was so bad I could almost not sit up. Like I told my husband, I was like, please meet me, set my stuff up, and because I need a drip. And within like halfway through, I could definitely tell a difference. And yesterday I was on the conference with you guys, and the next day, like I felt so much better. Day 2, I was like a whole new person.
Absolutely.
So,
and the team in North Carolina that I know that takes trips, and I want to try to get them over, is the Hurricane. So they go to a person right now, and all of them have set days where they go get their drips. So it's something that I think needs to be introduced more into the athletics that we play predominantly, like football and basketball, because I know y'all aren't doing it because we feel like we're soldiers, and we have a lot of misinformation. And I need you guys to start taking care of yourselves, like the baseball players, the golf players, the hockey players.
Think about if nothing else, think about self-care and the longevity of your career. Because in the long run.
Mm-hmm.
Don't you want to play longer?
Right.
Don't you want to do this healthy?
Mm-hmm. And without being
Healthier
in
than-
so much pain, you do not
Yes.
have to do it with so much pain.
Well, you don't.
Mhm.
You don't.
And the thing too about the IV drips, they lubricate your joints
Mhm.
and your muscles, and so it really gets to where you need it to be.
Have you to be more
and-
flexible.
Yeah,
Well,
I mean, because
absolutely.
you go and go and go, you don't hydrate enough. You're just tearing your muscles down.
And this would be really good for those of you who work out a lot and do
Yes.
CrossFit, because I see a lot of
Absolutely.
injuries in CrossFit, and it's mainly because you're not hydrating
Y'all
yourself.
here with hard knees.
Crumbling.
Yes. Because I'm gonna tell you, because it's the truth.
Yes, it's
You
a
know,
lot
because
of
you can
injuries.
and you can do drops.
Mhm.
You can do drops with that because
Yes.
it's all about taking care of yourself. Gotta take care of
So
yourself.
if you're going to work out, make sure that you're doing this in tandem. Make sure you're getting your IV drip. Make sure you're taking
Yes.
your drops. Make sure you're even losing lotion. I'm telling y'all, after you
Oh,
work out,
that
you
lotion.
done got your drip. You take a good hot shower
yes,
and you slather yourself in this good lotion and or oil. I'm
Yeah,
telling you,
yeah.
good.
So I was about to
night.
make a joke about that. So like my
What, the oil?
D2 athletes that
Okay.
don't have the trainers like the D1 athletes that will give you a massage.
Mhm.
If y'all go ahead and buy that massage oil and have a
Oh.
girlfriend or something like that, tell her to hit your shoulders and hit your legs after practice, you'll feel like a new man in the morning.
I'm
I
telling
promise you.
Telling you.
Or buy some and take it to your trainer, you D1 guys,
Yeah.
because you can do
Yes,
that.
they
Yeah.
can
Or
Buy
physical
it.
therapist or chiropractor.
Yeah.
Like
Yes.
make sure all of these things are being used in tandem, because what we do know with physical therapists is that they will use some sort of salve. So advocate for yourself.
Yes.
Say,
Well,
look, well, this is what I want. I want you to use this on me.
Yeah, because that's what John did.
Mhm.
That's what John did.
Mhm.
I mean, he took it to his trainer,
There we go.
and his trainer loved it.
There we go. Boom.
Yeah.
So
I mean-
let's start supporting small businesses
right.
and Black
Yes,
people.
yes.
Let's do it.
And take care of yourself.
Please.
Yes, you have to,
Mhm.
because ain't nobody else gonna do it.
Hello.
Okay.
Because let me tell you something, starting next month, Ken and I are going to start taking care of ourselves. Now,
Okay.
I'm not going to sit here and say that I'm going to take that drip.
I will.
Not going
We
down.
working on it.
We're going
What?
with baby
I
steps.
actually want to really take a drip to see how it feels.
I'll record you.
Yeah, because I don't have a problem with it.
I will
Oh, well,
record
you got ropes over there.
I know.
I
Mhm.
can hit one of those from here.
Mhm.
And look at, that arm. I mean, not just the AC, but yes.
Ugh.
I said I can hit that from here.
Mm-mm.
Lord,
Freaks me
I can put
out.
like a 14 gauge in that.
No, don't do that. Those hurt.
Oh,
I
please.
would
That's
do
the
you
long-
like
A
that.
stick is a stick is a stick.
No, Miss V.
No, not you got to know what you're doing.
That's true. Fair enough.
Yeah.
Fair enough. Because I've had horrible experiences. So
This is the one
Yeah.
time. Oh, I'm not gonna say that.
And I put a 24 on somebody today. She said, I didn't feel that. And I'm like, it's small. It was in the right there.
Let me shut my mouth.
I
Jesus.
knew where you were going. Knew where you were going. Reel it
Y'all two.
in.
I was,
He got you,
Did she
girl.
have,
I
did
caught
she,
myself.
did she have a
Like
Kamala moment?
and,
This
caught
month,
myself.
Right?
I caught myself. I caught myself.
Girl thing.
Thank you. But you saw it was right there.
Right
I was
there.
like, woo. Okay. Reel it back in. Reel it in, girl. Reel it in. It's a family show.
did I miss anything?
Yeah.
Did
You
I?
missed that. But go ahead, baby.
I caught it.
It was
I just let y'all do what y'all do over there.
It was moving. Yeah.
But
Kim caught it.
like we told you guys, Ken and I are going to start our overall health fitness journey starting next month with Dr. Janze. We'll keep you guys updated throughout our whole entire process. We're going to document everything. Dr. Janze is joining the TDS team, so she's officially one of our cousins, so you'll be seeing more of her. So you can get your questions answered, because what we do know is that come after the holidays, when people done sat there and got fluffy and ate, then
Right.
come January, and it's like, well, I want to lose this weight. Now
Yeah,
that
I
weight been
got
on
you.
you for the
Yes.
last 6 months.
When you
Don't
that healthcare goal,
Right.
that we all make January
Yeah,
1st.
January 1.
Right.
We're gonna
I'm
work
losing some
out
weight.
and eat better.
exactly.
Yes.
Now y'all want to come crawling to Auntie V and to Dr. Janze talking about I need help. We're gonna start this off before all of that. So, like I said, any
So that
questions
was
you
the last
have?
question.
Are there any health issues that can cause issues if you get the drip?
It's all vitamins, and it's just saline, which is the consistency of your blood. So you just like you take your vitamins, the foods that you eat, it's literally, it's just all vitamins. So
Boom.
no health issues.
Like I said, Ken will let you know how it is. Mhm.
That's all. Ain't got no
He will
problem.
let you know, and then
We're
maybe
gonna put her on some CBD and give her IV.
That's what we gonna do. That's what we gonna do.
that will be in
That's
a real
what we
in
gonna
itself.
do.
Kim finally got hurt.
Yeah.
Ooh,
Yeah.
child.
I can
be
put
all right.
IVs in babies, honey. I can do it to
I know
you.
you can. I would trust you. I would trust both of y'all. But,
Yeah,
whew,
we're gonna work it out.
whew.
We're gonna work it out.
CBD and relaxer.
I'll say the
It's
biggest
gonna
part.
be
I was gonna say
okay.
the biggest part is just don't look and just chill out.
I know.
Girl, honey,
Because
please.
Because if you do
That
this,
one
you're
right
gonna
there?
panic and tighten up.
Which one?
This one.
Really? They usually
Yeah.
always go here.
Why?
Oh,
That hurts.
that's why.
That hurts.
That's why
That
you
that
got
does
heat.
hurt.
Really?
Oh
Yeah.
heck yeah!
Yeah.
Anywhere around this thumb
Yeah.
area,
Hmm.
that hurts,
Oh,
honey.
And they
Even
always
up
go
here.
for this
Phew,
one. Hmm.
that hurts.
Well, that's
That's a
fine.
last resort thing.
Child.
That and the
Very
AC.
last. Yeah.
Really?
Yeah. Well,
Mm.
AC. I mean, everybody should hit that.
Okay.
I go
Yeah.
for it because it's quick and easy.
It's quick and
Whew.
easy.
But if you're in the hospital,
Mm.
that's
That's
Well,
it.
child,
Because we
well,
gonna we
like I
start
said,
down here and move up.
I
Because you
know.
always know you can get this one.
Oh, really? Well, I would say, yeah, this
Yeah,
one
no.
right here, she never fails.
Well,
She always
no,
pops
because
up.
it's quick and easy.
Mhm.
They get me here on this one.
Yeah.
Because all I did
like
was
said,
pump
I
that,
can
and
hit
then
this
next
from
thing you know,
here.
it's right there. And
That
then
is
over here, you
beautiful.
can see them over here.
See that I go here because it's quick.
And men have
In
these
and
like
out in 45
ropes.
minutes.
You
We
know,
won't
they just
try,
got
Dr.
this
James.
ropes.
We won't try.
And you just go.
Martin's
boom.
gonna come.
I'm
We're gonna do
excited. Let's do it.
Okay. All right.
Yeah.
I just want to see.
That'll
what
be
it
a
feels
whole
like.
reel in itself. Be like, I can't do this.
Yes, you can, girl.
I'll put
You
in the
can do this. You can do this. I'll do it with you.
Because I was thinking, I was about to say something before we get canceled. Let me.
I know. We pull it. We holding it.
Hold it. Because somebody going. Didn't you say like
Making
and I
Jesus
did.
like 4 syllables. Jesus, help me, because it's coming right there.
Yeah, we have fuck up nights tomorrow. If you are in the area, please join us. We have 4 new stories, 4 new fuck ups, and it is a really, really good time. We're going to be at Frontier RTP. As you know, Auntie V is one of our fuck up nights alum.
Yes.
So we are just going to keep
Good
it
time.
going. It's a really good time. It just lets you know that failure is familiar and it's going to happen in your journey to success. So amazing night. Like I said, tomorrow, Frontier RTP. Really easy. Just put it in your phone. You can get there. And we start promptly at 7 p.m. Boom.
Word. And that's it.
Yes.
I don't know where. There it is.
Make sure you follow Dr.
Please
Janze
follow. Yes.
and Miss V.
Yes.
Mhm,
Give y'all websites.
So I am at www.embodihydration.com. That is EMBODI hydration.com.
Boom.
Girl, look at she about to do the dance. The Eminem dance. Yes. Thehealingconsultant.com. Y'all please like and follow on The Healing CBD. And honey, that's where our testimonials will be.
Boom. Mhm.
All right. And everybody have a safe night.
Bye.
Peace.
Bye.